Telemedicine, bringing care to you. Presented by the Committee on Rural Health Improvement. So first we want to look at what exactly is telemedicine. And I'm going to give you two definitions. The first is the fancy technical definition. It's the use of medical information exchanged from one site to another via electronic communications to improve a patient's clinical health status. Complicated, right? It's really not. In layman's terms, it basically means using technology to bring healthcare services closer to you. There are two things involving telemedicine that I want to look at. First, we'll look at international telemedicine. Outsourcing has been pretty common in most industries within the United States because it's cheaper to make and produce things in other countries. Well, healthcare hasn't really had this luxury up until very recently. Nobody can figure out how you can outsource healthcare when the people that need the treatment are here in the United States. Well, telemedicine has kind of introduced this outsourcing to the healthcare industry by providing physicians in other countries or providing services to people in other countries. By outsourcing different areas of healthcare, we can ensure that we're keeping the prices down. Like I said, we can pay people less in other countries than we can here in the United States. Another reason that we haven't really been able to outsource in healthcare in the past is because we didn't have the technology. But now there's been new technology and new science created that allows us to send information to doctors in other countries or to receive information from clinics in other countries that would allow us to treat those in rural areas or send information about patients here in the United States to doctors in other places instead of paying the physicians here. Now I'm going to provide you with a couple of examples of how telemedicine is being used internationally. So one of the most expensive fields of healthcare here in the United States is radiology. Not only are the physicians very costly, but it also costs a lot to have a radiologist on staff 24/7 when you don't really know if you're going to need them. So telemedicine has kind of created a solution to this problem because we can now use our technology to send x-rays and test results to physicians in other countries, and we don't have to pay those here in the United States. So this can work. Whereas you have to pay a physician more for night shift, it's day in another country, and so you wouldn't have to pay that differential. And you also typically can pay physicians in other countries less. Now, instead of outsourcing stuff that's happening here in the United States, we can also use telemedicine to provide services for people in other countries. What we can do is we can place a representative in this other area, and then we can use the technology to connect physicians here in the United States with those representatives somewhere else. And this allows physicians here to see patients in other places visually. We can connect the vital signs. This just allows people that wouldn't necessarily get great treatment in other countries to receive treatment that, for all intents and purposes, is much better than anything they could receive. And this also creates an alternative income source for people here in the United States. So an organization that sets up a telemedicine clinic in another country has now opened up themselves to bring in more income than they would just by treating those people here in the United States. So now that we have looked at how telemedicine is being used in other places, we can look at how it's being used here in the United States. When you hear someone refer to good healthcare or improving healthcare, you're likely to hear them say something about the iron triangle. And what is the iron triangle? It's basically the three parts that constitute good healthcare. And so you want a high quality care, you want high access to care, and you want low cost care. And so telemedicine can kind of focus in on creating better access to care and also reducing the cost of care. And we can see how telemedicine affects those access and cost parts of the iron triangle by looking at how telemedicine is being used in rural America. Running a practice in a rural area is going to be pretty expensive. You aren't going to have that opportunity to share a clinic space with other physicians. There's not going to be that high patient traffic. You're not going to have as many physicians and nurses to operate the practice or the clinic. In general, it's just going to be a little bit more expensive. But telemedicine allows physicians to provide care in these areas that otherwise probably aren't going to have any practices or clinics. And so, according to the American Telemedicine Association, in 2012, there were 3,500 telemedicine sites around the United States. They are pretty common in rural areas of Alaska, but pretty much every state has them. They're also pretty popular for Native American reservations, so places that don't really have access to regular clinics. And by doing this, you're saving your patients time and money. They're not having to drive long distances to get to other clinics, and that's saving them gas money, and it's also, like I said, saving their time. Looking at how telemedicine works, there's two different kinds of telemedicine. You have a telemedicine site, which is going to be when there is some kind of nurse practitioner, physician's assistant, or nurse that sets up a representative, like a site where, a connection site, where the main organization, the physician, the large hospital can connect with. So you're going to have the patient with the nurse or representative, and then you're going to have the technology that allows them to connect visually and using special vital sign equipment with the main organization and the physician. Now you also have at-home telemedicine, which allows you to connect from your personal computer, cell phone, anything like that, with a physician. And there's special programs, special monthly memberships where you can use this type of software. And here's a little video to show you how that works.
When the inevitable happens and someone in your family gets sick, there is nothing as aggravating as being forced to sit and wait for hours in an emergency room or doctor's office. Then you only see the doctor for a few minutes before you are hustled out the door to deal with insurance and paperwork. Doctor visits are expensive, time-consuming, and frustrating. But what if you and other colleagues at your company could have phone and internet access to a nationwide network of licensed doctors 24/7 and save on health insurance costs? Introducing telemedicine, a solution for the 21st century. Imagine being able to call or internet chat with a doctor who will diagnose your problem, answer questions, and prescribe medication if needed to your pharmacy. No waiting in line or filling out insurance paperwork. It provides straightforward answers and solutions for routine illnesses. How does it work? Zach hasn't been feeling well for several days, so he decides it is time to find out what's wrong. Instead of making an appointment with a doctor or going to an emergency room, he calls the toll-free number or goes to the telemedicine website to set a phone or internet appointment with a licensed doctor in his state. During the call, the doctor will diagnose his illness and answer his questions, and if needed, write a prescription. Bingo! It's done, and Zach is on the way to feeling well. Telemedicine is not health insurance. Put simply, it is a monthly subscription for routine healthcare services. Not only does it save hours of time and frustration waiting for a doctor in an emergency room or clinic, there is no deductible and no co-insurance, which saves individuals and businesses lost income due to employees being away from work. The AMA stated that 78% of all ER, urgent care, and doctor's visits could be handled safely and effectively over the phone. If staying out of a medical clinic or emergency room sounds like a great idea to you, find out more by visiting www.telemedicineforyou.com.
And outside of just your normal, regular primary care physician clinic, there are a few other uses for telemedicine. It's quite common to have a psychiatric clinic to serve areas that don't have access to psychiatrists or psychologists, especially, very, like I said, very rural areas. Telemedicine has also been popular in correctional facilities. So instead of having to pay to bring a doctor out to your facility, you can use this equipment and this technology to do everything via the software. And also, telemedicine is really helpful in monitoring chronically ill patients. So instead of having someone who is in the hospital or in a physician's office, several times a week or even a couple times a month for some diabetes or a heart problem or something like that, they can now meet with their doctor through their computer or through a site, and they don't have to make those trips and go sit in a waiting room and see their doctor all that frequently. And the last thing that I want to talk about telemedicine is obviously there's going to be some drawbacks to it. You aren't getting that one-on-one patient-physician interaction. You're still meeting with your physician, but you're not getting that personal contact with them. You're not getting to spend that one-on-one time with them, so you're not building that bond with your physician. And also obviously the technology is going to cost a good bit initially. So buying all of the software and purchasing the visual aids and the vital sign equipment, that's all going to cost a good bit of money. And then there's also going to be some security and privacy concerns. Anytime you're talking about sending classified medical records across, if you're talking internationally, if you're sending it across the ocean or into another country, obviously people are going to be concerned about how that private information is staying private and how you're preventing security breaches and things like that. And so that concludes the presentation on telemedicine. And it's a very interesting topic, and if you have any questions, there's lots of YouTube videos out there, and the American Telemedicine Association's website is a great source. Now I'm going to present you with some review questions just to make sure that you got a full understanding of what was being said. So the first one, what is telemedicine? Number two, what fields of medicine might use telemedicine? And number three, what are some concerns about telemedicine? And here are your answers. Telemedicine is the use of technology to bring healthcare services to those in need. The fields of medicine that might use telemedicine: primary care, radiology, and psychiatry are just some examples. There are obviously more than that. And what are the concerns about telemedicine? You don't have that interaction with your physicians. There's the cost to start up and security. So now just to conclude things, telemedicine can be very useful for those in rural areas or for international care. It can provide care to those who might not otherwise have care. And yes, there are drawbacks, but there are drawbacks to anything. I think it's more important to bring care to those in need. So once again, this is the Committee on Rural Health Improvement bringing you telemedicine.